He has a urethral stricture and needs to be addressed via urethral reconstruction by taking tissue from the mouth to reconstruct the urethra. The Bladder Health and Reconstructive Urology Institute specializes in pelvic organ prolapse reconstruction, urinary incontinence, voiding dysfunction, urethral reconstruction, and reconstruction of the urinary tract. Our practice, we focus a lot on the proper diagnosis because we believe that a proper diagnosis is at the cornerstone of achieving excellent outcome in urology. I think at this point in the field, it's both a science and an art, because often in reconstructive surgery, we don't exactly know what we're going to do until when we start dissecting the tissues and then we see what options are available. I believe the reconstructive urologist must be versed at different techniques because sometimes the surgical approach may change while you're performing the surgery itself. This patient was unable to urinate and did not respond to medications. So therefore, we have to surgically remove all the prostate tissue that is blocking the flow of urine from the bladder. What brings me joy is when I have the unique opportunity to improve a patient's quality of life.
I was 59 years old when I had prostate cancer, and that I could deal with. I couldn't deal with the incontinence.
Because of the severity of the urinary incontinence, what we call gravitational urinary incontinence, he was offered the implant of the artificial urinary sphincter.
I had no life prior to the procedure, and once I had the procedure done, he gave me back my life. I became whole again.
It originally started with the urinary tract infections, constant urinary tract infections, and then what really got me to a urologist was when I experienced blood and clots in the urine.
She developed a very small bladder capacity, a very friable bladder that was storing urine at high pressure, that was damaging both of her kidneys. Many people would be intimidated by the surgery because when you hear that a surgeon is going to cut a piece of your intestine and then take that piece of intestine to make your bladder bigger, it must have been intimidating.
From all that I've been through, I was just like, well, by faith, I just prayed and said, okay, I'll have it done. I feel brand new person. I can exercise now. I can get back into my exercising and I just feel good. I just feel relieved and just healthy, really.
My life before was I could be walking down the street and all of a sudden I would just lose water. And I got to the point where I was almost afraid to leave the house.
When she coughs, she leaks urine and urine escapes, so she had the sling operation for that. Then her urge incontinence persisted, which I expected, and that was successfully treated by injecting Botox in the bladder.
And afterwards, it's like a life-changing experience for me.
We are doing some very interesting work at this institution. One of the work that for me is fascinating is the development of a new type of artificial urinary sphincter. What is different about this device, it does not require a hydraulic system. It's a wire, and this is a cuff. It's a very simple assembly.
The simplicity of it is that the patient would be given, after the implant, a handheld car key-like activation system and would be able to open and close the device when they needed to urinate.
The other advantage of this device is that it will adjust to various ranges of pressures. We do have an active fellowship and training as part of the practice.
Drain the void was given right here.
And where was the rise in pressure? I've been involved in working with Haiti at several levels. I participated in multiple medical missions right after the earthquake, but currently I was designated by the American Urologic Association leadership to help develop urology in Haiti. And we are currently working with the urologists and the urology residents in training in order to provide assistance and guidance to be able to improve urologic care in Haiti. What I would like to see in my practice is to continue to increase awareness that many patients who are suffering can feel that there is hope for them, that there is help for them, that they do not necessarily have to spend the rest of their life suffering from these problems.